Um, Hi, good evening. My name is Terika Thomas Mills, and I'll be demonstrating NG tube insertion. I'm going to start by verifying my physician's order and the indication. I am going to gather my supplies. I have my 18 French NG tube. I have my pen light. I have my towel. I have my gloves, my tape, my specimen cup. I have my suction apparatus with the tube and canister connected if prescribed, and I'm going to verify that my suction is working and in order. I have my 20 to 60 ml syringe. I have my basin with warm water. I have my lubricating jelly, and I have my safety pin. Okay, so I am gonna enter my patient's room. Knock, knock, knock. I'm gonna close the door behind me for privacy, and I am gonna perform my hand hygiene, and then I'm gonna apply my gloves. Hi sir, my name is Terry, and today I'm gonna be your nurse. Can you verify your name and date of birth for me? Okay, so Mr. Mills has correctly identified himself using two patients' identifiers. All right, so okay, Mr. Mills, today the doctor has ordered the placement of an NG tube. What this is a tube that goes through the nose and down the stomach. This tube is gonna be connected to low continuous suction, and it's gonna clear your stomach and make it's gonna clear your stomach of any stomach content. That way your bowels, this will give your bowels a chance to heal. Is that okay with you? Okay, so I am gonna raise the bed to a high working position. I'm gonna place Mr. Mills in a high Fowler's position if tolerated. I am gonna start by placing my NG tube in a basin with warm water. What this does, it warms it up and makes it a little more applicable. I am gonna go ahead, I'm gonna apply my towel. Okay, and then I'm gonna take my pen light and I'm gonna assess Mr. Mills. I'm gonna assess him. Mr. Mills, can you look up for me? Okay, so all right, so I'm going to be assessing for, I'm going to be looking for any obstruction or deformities. I'm going to look for intactness of tissues, tissues of the nostril. I'm going to be looking for any redness, any swelling, any irritations, and any abrasions. Okay, so Mr. Mills, can you cover your left nostril? And then you're gonna take a deep breath, and then you're gonna breathe in and out through the right nostril. Okay, good. All right, now you're gonna go ahead, you're gonna cover the right one. You're gonna take a deep breath and you're gonna breathe in and out through the left. Okay, so now it sounds like the left nostril has a better airflow, so that's the one I'm gonna be using today, okay? So I am gonna go ahead, I am gonna take my tube. Okay, so I am gonna be measuring from the tip of his nose. I'm gonna measure to the tip of his ear, all the way down to the xiphoid process. And for Mr. Mills, this is gonna be 50 centimeters. So I am gonna use my tape. I'm gonna mark it at the 50 centimeters. Mr. Smith, Mr. Mills, I'm sorry. Can you hold your head back for me? All right, can you look up? All right, so I'm gonna insert this tube in your nose. When it reaches the nasopharynx, what we call the back of your throat, I want you to lower your chin and you're gonna lower your chin, and then you're gonna take a sip of water. And then each time you swallow, I'm gonna insert a little bit further, okay? If for any reason you start gagging or have difficulty breathing, just raise your hand and then I'll stop and give you a minute, okay? I am gonna take my lubricant. I am gonna lubricate the tip of my tube. I am gonna lubricate the tip of my tube. Can you look up for me, Mr. Mills? All right, so I am gonna go ahead and I'm gonna insert it. If for whatever reason on the initial insertion, if I encounter any resistance, then I'm gonna remove it. I am gonna re-lubricate and then I'm gonna try the other near, okay? All right, so I am gonna go ahead. I'm gonna insert it. I'm gonna follow the nasal passage all the way back. As I insert, I'm gonna instruct him to bring his chest, to bring his chin to his chest, and then he's gonna take a sip, take some more water. All right, so I'm gonna continue to insert all the way till I have gotten to the desired length, which is gonna be 50 centimeters. Each time he takes a sip of water, then I'm gonna insert 2 to 4 centimeters more. I'm gonna advance 2 to 4 centimeters more. All right, so once it's indicated that if for whatever reason he starts gagging, then I am gonna let him have more sips of water until the gagging has subsided, and then I'll continue. Once it's indicated that the tube, it's verified that the tube is in the right location, I am gonna aspirate for 5 to 10 ml of stomach content. And then I'm gonna place this in my specimen cup, and then I'm gonna use my pH strip and I'm gonna test the content of the specimen that I've collected. I am gonna ensure that ideally the pH is gonna be between 1 to 5, and once it's indicated that the pH is between 1 to 5, then it's a good indicator that it's inside the stomach. And so I'm gonna go ahead and secure it. If for whatever reason the placement seemed to be incorrect, then we'll have to remove it and then we try again. Okay, we are gonna secure the tubing the tubing has been secured to the bridge of his nose. And then I am gonna go ahead, I'm gonna take the safety pin and I'm gonna secure it onto the side of his gown, and then I'm gonna lower the bed. I will also get an x-ray to verify that the tubing is in fact in his stomach. And once the position has been confirmed that it's in his stomach, then I'm gonna attach the continuous suction and verify that the NG tube and the suction stays unclamped and patent. I will continue to assess and document the content of the suction canister, including the amount, the characteristics, and the amount and characteristics. Once I'm done with all of this, I'm gonna discard my supplies. I am gonna ensure that the bed is in a low and locked position. I'm gonna ensure that the patient is in a comfortable position. I am gonna go ahead and gonna discard my gloves. I am gonna perform my hand hygiene, and I'm gonna go document my procedure. For this documentation, I have to include the care that was provided, the assessment's finding, and also document the patient's response.